So here's our patient. She's a 74-year-old female. She fell maybe about 4 or 5 months ago directly on the right shoulder, complaining of continual pain. Really didn't have any treatment. She had an MRI done which shows complete supraspinatus tear and biceps tendon tear. Also read as a complete infraspinatus tear. My reading, I thought there were some fibers preserved of the infraspinatus tendon. Also a labral tear. She has a lot of superior migration of the humeral head consistent with her rotator cuff arthropathy. On physical exam, she can actually raise the arm to about 160 or 170 degrees, and abduct maybe to 160 degrees as well. She has a little bit of discomfort with that, but pretty impressive motion considering those findings. She does have a positive Popeye sign, which you can see on that arm. And flex your other one. You see the shape of that one is different. It's a little more elongated. That one kind of bulges. Really make a muscle hard on the right side. Okay. Biceps tendon in short axis. Left side of the screen is medial. And actually may see a little residual biceps here. MRI did not show any biceps in the sulcus. And I believe we're not seeing one, just maybe some overlying ligaments that may have collapsed into that sulcus. As we go distally, you can see the pec major tendon. And then you can see the biceps tendon here distally just before the pec major tendon. Right side of the screen is distal. You see the nice humeral surface there, and you just don't see a biceps tendon. Let's see if we can try to find it. Here we are distally. I couldn't make out a biceps tendon. So distally there is somewhat of a biceps tendon, so probably had some retraction. Let's look at her subscapularis tendon. That I thought had perhaps an intermediate or high-grade partial tear. She's got fibers there attaching to the lesser tuberosity. Here's a fairly normal-looking subscapularis tendon. Left side of the screen is medial. You can see her coracoid. Okay, now we're going to do a short axis view of the subscap tendon. Just really keep that arm out like that, yeah. Right side of the screen is inferior. You can actually see some fairly decent fibers here. Okay, now we're going to look at our supraspinatus tendon. This is our most important view. This is the tendon that I believe is completely torn. Here we are, long axis view. Really just do not see any supraspinatus tendon. Just deltoid muscle right on top of the humeral head. You can see our acromion on the left side of the screen. I'm going to go ahead and do a short axis view now of the supraspinatus tendon. Left side of the screen is cephalad. You can see a nice cartilage interface sign here. And we're going down towards the bicipital groove. You don't see a biceps tendon. We're going posterior, just seeing deltoid muscle right on top of the humeral head, cartilage interface sign. Here's our infraspinatus muscle. You can see that, and then I do believe there are some fibers that are attaching onto the graded tuberosity, which I can see on the MRI as well. So I'm going to still call her infraspinatus tendon there. And this is short axis, excuse me. Top is superior, bottom is inferior. So I'm looking at the infraspinatus muscle on the left, teres minor on the right. You have a little calcification there. So you can see the scapula spine here, kind of separating supraspinatus from infraspinatus. Ultrasound that these tendons are intact posteriorly. 75-year-old female here for ultrasound again of her right shoulder. She did have a rotator cuff repair for massive tears of the supraspinatus and much of the infraspinatus tendons. We just did an MRI. This is about 3 months post-op, and unfortunately, as per my reading, I think the repair unfortunately failed and the tendons retore. Basically, there's not much supraspinatus tendon left, and I think much of the infraspinatus tendon is torn as well. So here, we're just basically right side of the screen is lateral. We're just looking at some of those suture anchors that we saw in the MRI, and we're really not seeing much of a tendon attached to it. You got basically deltoid muscle going right down to the bone. And one thing you want to make sure that you don't mistake is an interface between the deltoid muscle and the humerus, as it does appear to be a bright line similar to a suture, but that's just an interface of the muscle with the bone. And I believe that suture anchor is kind of right near the surface. I believe it may have pulled out. You can see just a long suture here. And also you can see a bright straight line consistent with a pulled out suture anchor. And then we go down, we got suture material. So right side of the screen is lateral. And here again we're trying to find our infraspinatus, and again I don't really see much of an infraspinatus. We got the graded tuberosity, really not much of a tendon. Here's the muscle belly. It's a little bit bright, I think, consistent with some atrophy, which you can appreciate on our MRI. And here you can see significant atrophy of both the supraspinatus and infraspinatus muscles. The circles around the infraspinatus muscle. Here we are. So looking at the two muscles, this is teres minor on the right side, and we got infraspinatus on the left. And you can see how the teres minor is dark, basically normal-looking muscle. Then you get all this kind of hyperechoic, atrophic infraspinatus muscle. And then I'm going to go closer towards the cuff now, 839. The teres minor looks healthier and bigger than the infraspinatus. And you can see some fluid posteriorly.